NuFix provides a posterior spinal solution through facet fixation by stabilizing the spine and reducing pain. Anti-migration fins are unique to NuFix, providing resistance to graft migration. The dowel is osteoconductive, thus promoting bone healing by providing a scaffold to which new bone can attach and grow. Increased surface area promotes more new bone attachment and growth. NuFix is precision machined from femoral and tibial allograft, which provides natural fusion. One end of the dowel is tapered for ease of insertion through the lockable inserter. NuFix instrumentation increases procedure safety. Instruments unique to the facet fusion procedure include the facet locator, the carbon fiber handle, the drill guide, the drill, the facet sound, and the inserter. For the minimally invasive procedure, an additional set of instruments are needed called the spinal dilation tube set, which contains a guide pin and 3 dilation tubes labeled Tube 1, 2, and 3. To begin, the guide pin is introduced through a small incision over the appropriate facet joint. Establish the correct angle and placement with the aid of fluoroscopy. A jam-sheety bone marrow needle can be used if needed to help place the guide pin in the correct position. Once the guide pin is in place, dilation tube 1 is inserted over the guide pin and down to the facet joint. Then dilation tube 2 is inserted over tube 1 down to the facet joint. Then dilation tube 3 is inserted over tubes 1 and 2 down to the facet joint. Remove the guide pin in dilation tubes 1 and 2, leaving dilation tube 3 in place for the remainder of the procedure. Place the facet locator down tube 3 and into the facet joint. The facet locator establishes the angle of approach and should be placed in the middle of the joint. The facet locator and dilation tube 3 are radiolucent. Under fluoroscopy, the radiolucency helps establish the correct angle and targets the middle of the facet. Slightly rotate the facet locator to feel both sides of the facet joint. Place the drill guide over the facet locator down dilation tube 3. The white lines on the proximal end of the facet locator are lined up with the white lines on the proximal end of the guide. This alignment aid allows the larger distraction teeth to be oriented correctly and in line with the facet joint. Gently tap the drill guide into place. Remove the facet locator. Insert the drill into the drill guide. Drill until the depth stop touches the guide, then remove the drill. Insert the facet sound into the drill guide to ensure an endpoint and sides to the hole if warranted. Load the NuFix dowel onto the inserter. Advance the NuFix dowel down the drill guide. Gently tap the inserter until the depth stop hits the proximal end of the guide. NuFix is now in place within the facet joint. Remove the inserter, drill guide, and dilation tube 3. If NuFix is not inserted deeply enough at the end of the procedure, it can be inserted more deeply by using the facet sound through dilation tube 3. The same steps are repeated for the other facet joint located at that level. NuFix offers a posterior spinal solution through facet fixation. NuFix stabilizes the spine and reduces pain. The procedure can be performed minimally invasive or open. The procedure is cost-effective, reduces OR time, and decreases hospital stay. NuFix instrumentation increases procedure safety and decreases tissue and bone destruction. The procedure reduces blood loss and results in high patient satisfaction. The textured surface of NuFix provides graft stability and resistance to graft migration. A lumbar brace is used with no flexion or extension physical therapy for 6 weeks.